First of all, President, I stopped my gynecology surgery 15 years back. So, court has passed an order. It's true that some of us did practice gynecological surgeries. I even taught, to tell you honestly, because we were trained like that. There was a transitional period in early 90s when we learned from our teachers and surgeons. There was a crossover. We all performed hysterectomies. I even taught deliveries to some of the gynecologists, to tell you honestly, because my teachers were doing that, and later we went out of thing. And the second thing is, I was just telling ma'am from Mumbai, Dr. Woodwadia, we always should remember. He was father of the laparoscopic surgery, who taught us what's laparoscopy and what laparoscopic surgery is, apart from many other greats. In Karnataka also, few of our surgeons had started in the early 90s, and we all followed the footsteps. The second, I appreciate the green initiative taken by all of you under IAGS, planting trees. Even Rajiv Gandhi University of Health Sciences, in association with the Association of Surgeons of India, Bangalore chapter, we are making all our campuses. We have 1,500 institutions under Rajiv Gandhi University of Health Sciences, making it one of the biggest in the globe, probably the biggest in the globe in terms of health education. So we are making all our campuses. We are trying to introduce plastic-free and green initiative and eco-friendly campuses, and also drug-free, tobacco-free campuses. So congratulations to you for taking such an initiative, because ecology and green initiatives always actually are the initiatives should be taken by societies like surgeons or gynecologists or physicians or doctors associations. We should be role model to the whole society in initiating such steps. I always tell our juniors and the colleagues to take such small initiatives which make us lead the path. Recently, we also took an initiative. You can also take such initiatives from your association. It's only not that we have not done it, but it's a role model to the society. But because we have 350,000 students under Rajiv Gandhi University of Health Sciences and 40,000 teachers under us, we are pledging our organs. We have started taking that initiative. We are inspiring our youngsters. If you go through the statistics, we only have 4 lakh people who have pledged their organs in the whole country. And every year about 18,000 to 19,000 transplants are happening, and about 3 lakh people are waiting for the transplants. So we have taken this initiative, and in my campus alone, in the administrative building, we have more than 200 people pledging on a single day, and we have taken this initiative and taking it forward in the future. So such initiatives will be definitely appreciated. Anyways, coming back to this present day conference, you all come from different parts of India. Dr. Ramesh took this initiative about 25 years back, and it's a silver jubilee. Kudos to all of you and congratulations. Dr. Ramesh, I was telling Dr. Paul, his mentor, was a student at Mysore Medical College. We all studied together. In his undergraduate days itself, as a final year student and intern, he used to attend more gynecology ward rounds and OTs than other things. We used to call him, those years only, we used to call him OBG Ramesh. So he went on to become a gynecologist. I am very happy when he came back to the city in late 90s with laparoscopic training at probably Kerala and Mumbai, both places. And he came and spoke to me. I was Senate and Syndicate member those years. And he said we should practice this and also teach our youngsters. We need to take some initiative in spreading this. So I introduced him to a few of the hospitals, invited him to my own college, Kempegoda Institute of Medical College, and the places where I was practicing. We together, I was just learning those years laparoscopy, and together we did laparoscopic appendicectomies and cholecystectomies, all such surgeries we started. And those years only, he was very, very fast and very confident. I used to tell him, you need to be little slow down and try to practice methodically and systematically. But he was very fast, he was quick because he was very confident. And then later on, he started his own setup and then came to me to start an initiative that Rajiv Gandhi University really took up in Bangalore and all parts of Karnataka today. We have more than 80 fellowship programs under Rajiv Gandhi University of Health Sciences. One of the first initiative was the minimally invasive surgery, laparoscopic surgery and endoscopic surgeries. And it was started at Altius, his own hospital. Those years it was called Ramesh Hospital. And I went personally to inspect the institution and also to inspect the teachers, have a word with them, and then we started this course. 18 months course. It was 12 months and then later increased to 18 months. And because he started, everybody else slowly learned laparoscopic surgeries, endoscopies, all that minimally invasive procedures. And then they took initiative and started all over the state. And today we have, in surgical field alone, we have more than 45-50 certification courses. All over India, students come and learn here. We are very proud that we took that initiative. And conferences like this and workshops where you really, the day is about the upskilling ourselves and passing on the skill to the younger generation. So it's just not teaching inside the four walls. It's about hands-on training. You all very well know about it. And conferences like this, in the presence of the bigwigs, the names itself is sufficient enough for people to learn and get attracted by such workshops. And today we have more than 400 delegates here, making it one of the biggest probably. And it's all because of the efforts by Dr. Ramesh, Dr. Vidya. She is very dynamic, always talking to people, communicating. And she also has started such courses in her own hospital. I had gone for one of the inspections as examiner. And I appreciate the efforts by the Karnataka Gynecological Association, BGS, right? BGS, IIG, and all such associations.
And used to come and the surgery was till 12 o'clock. My adolescent strong family always like to argue with the youngsters. Those days, Ramesh was a firebrand and he tried to question everything. And our discussion goes on late midnight. And I could recollect those days, and now Ramesh has gone to Eastern or well respected, and he was pioneer in establishing endurance labs to be Kannada. So thank you, Ramesh, for giving me.
big heart for all these people, Dr. Hafiz, Dr. Paul, Krishna Kumar sir, Trivedi, and of course all of you who started laparoscopy before me, to accept that this is something new that I taught. When I entered laparoscopy, they said, ureter is mother-in-law. I love to take care of your mother-in-law. And I hope that you continue to take care of your mother-in-law in future. Thank you, Dr. Ramesh. This is an honor for me. Very, very big honor. Thank you.
Sailaj's first workshop, I think probably we were in Gymkhana. We used to stay in the Gymkhana. And from first workshop till this workshop, all workshop with Ramesh, I have been there. With Ramesh, one of the biggest point is every time when you meet, you feel he's innovating and still learning. You feel he's innovating and still learning. You can't realize the amount of investment he has made not only in his hospital but also in his village in charity. I think so that deserves a big round of applause. He does a lot of charity. And also not to forget that Bangalore, I became the president of IIG in Bangalore when Ramesh and everybody were there. And I have pleasant memory of becoming president of IIG in Bangalore. Kamini Rao and Hima and all were there. So a lot of wonderful memory, and not to forget, Bangalore gave us the cadaveric course. So I think so Bangalore has a lot to contribute. Ramesh has contributed too much. I feel people like Ramesh should go much higher up, as Shailesh will be AGL president to my knowledge. And you also deserve to be there. Thank you.
ನಮಸ್ಕಾರ, ನಾನು ಡಾಕ್ಟರ್ ವಿ ರಮೇಶ್, ಆಲ್ಟಿಯಸ್ ಹಾಸ್ಪಿಟಲ್ನಲ್ಲಿ ಲ್ಯಾಪರೋಸ್ಕೋಪಿಕ್ ಸರ್ಜನ್ ಮತ್ತು ಗೈನಕಾಲಜಿಸ್ಟ್ ಆಗಿದ್ದೇನೆ. ಸೊ ಇಲ್ಲಿ ನಾವು 3 ದಿವಸದ ಒಂದು ಕಾರ್ಯಾಗಾರ ಮತ್ತು ಒಂದು ಕಾನ್ಫರೆನ್ಸನ್ನು ಏರ್ಪಡಿಸಿದ್ದೇವೆ. ಸೊ ಇದರ ಹೆಸರು ರೇಜ್ ಅಂತ ಅಂದರೆ ರೀಸೆಂಟ್ ಅಡ್ವಾನ್ಸಸ್ ಇನ್ ಗೈನೆಕ್ ಎಂಡೋಸ್ಕೋಪಿ. ಅಂದರೆ ಲ್ಯಾಪ್ರೋಸ್ಕೋಪಿಕ್ ಸರ್ಜರಿ ಅಥವಾ ಕೀ ಹೋಲ್ ಸರ್ಜರಿನಲ್ಲಿ ಸೊ ಇತ್ತೀಚೆಗೆ ಏನೇನು ಆವಿಷ್ಕಾರಗಳಾಗಿದೆಯೋ ಅದನ್ನು ನಮ್ಮ ಡಾಕ್ಟರ್ಸಿಗೆ ಒಂದು ರೀತಿಯಲ್ಲಿ ಟೀಚ್ ಮಾಡೋದು, ಅದನ್ನು ಅಷ್ಟು ಸುಲಭವಾಗಿ ಕಲೀಲಿಕ್ಕಾಗಲ್ಲ. ಅವರು ಸಾಕಷ್ಟು ಸಲ ನಾವು ಅವರಿಗೆ ಟೀಚ್ ಮಾಡಿ ಒಂದು ಎಜುಕೇಟ್ ಮಾಡಿ ನಾವು ಕಲಿಸ್ಬೇಕಾಗುತ್ತೆ. ಸೊ ಈ ಕಾನ್ಫರೆನ್ಸಲ್ಲಿ ಸಾಕಷ್ಟು ಒಂದು 25 ಆಪ್ರೇಷನ್ ಇವಾಗಲೂ ನಡೀತಾ ಇದೆ. 25 ಆಪ್ರೇಷನ್ಗಿಂತ ಹೆಚ್ಚು ಆಪ್ರೇಷನ್ಗಳನ್ನು ಮಾಡಲಾಗುತ್ತೆ. ಮತ್ತು ಆಲ್ರೆಡಿ ಮುಗಿದಿದೆ. ನಾಳೆ ಒಂದು ದಿವಸ ಒಂದು 1 ಡೇ ಫುಲ್ ಕಾನ್ಫರೆನ್ಸ್ ಇದೆ. ಸೊ ನ್ಯಾಷನಲ್ ಮತ್ತು ಇಂಟರ್ನ್ಯಾಷನಲ್ ಲೆವೆಲ್ಲಿಂದ ಬಂದಿರತಕ್ಕಂಥ ಸಾಕಷ್ಟು ನುರಿತ ವೈದ್ಯರು ಅವರ ಪ್ರಬಂಧವನ್ನು ಮಂಡಿಸಲಿದ್ದಾರೆ ಮತ್ತು ಹೊಸ ಟೆಕ್ನಿಕ್ಸನ್ನು ಅವರು ತೋರಿಸಲಿದ್ದಾರೆ. ಸೊ ಇದರಿಂದ ನಮ್ಮ ಡಾಕ್ಟರ್ಸಿಗೆ ಮತ್ತು ಸ್ತ್ರೀರೋಗ ತಜ್ಞರಿಗೆ, ಎಸ್ಪೆಷಲಿ ಲ್ಯಾಪ್ರೋಸ್ಕೋಪಿನಲ್ಲಿ ಮಾಡ್ತಕ್ಕಂಥ ಒಂದು ಇದರಲ್ಲಿ ಸೊ ಅವರಿಗೆ ಸಾಕಷ್ಟು ಪ್ರಯೋಜನ ಆಗುತ್ತೆ ಮತ್ತು ಅದನ್ನು ಅವರು ಸ್ಕಿಲ್ಲನ್ನು ಅಪ್ಗ್ರೇಡ್ ಮಾಡ್ಕೋಬೋದು. ಸೊ ಇದರಿಂದ ರೋಗಿಗಳಿಗೂ ಭಾಳ ಒಳ್ಳೆಯದಾಗುತ್ತೆ ಮತ್ತು ಒಂದು ಟೆಕ್ನಾಲಜಿನೂ ಸಹ ಮುಂದುವರೆದಂಗಾಗುತ್ತೆ. ಸೊ ಆದ್ದರಿಂದ ಇದನ್ನು ಪ್ರತಿ 2 ವರ್ಷಕ್ಕೊಂದು ಸಲ ಮಾಡ್ತಾ ಇರ್ತೀವಿ, ರೇಜ್ ಕಾನ್ಫರೆನ್ಸ್ ಅಂತ. ಇದು 25 ಇಯರ್ಸ್ಗೆ ಕಾನ್ಫರೆನ್ಸ್. ಇದು 25th ಇಯರ್. ನಾವು 2000 ವರ್ಷದಲ್ಲಿ 2000 ಇಯರಲ್ಲಿ ಫಸ್ಟ್ ಕಾನ್ಫರೆನ್ಸ್ ಮಾಡಿದ್ದು. ಅದಾದ ನಂತರ ಸತತವಾಗಿ 25 ವರ್ಷದಿಂದ ಈ ರೀತಿಯಾದಂಥ ಕಾನ್ಫರೆನ್ಸ್ ಮಾಡಿ ಸಾವಿರಾರು ಜನ ವೈದ್ಯರಿಗೆ ಮತ್ತು ಸ್ತ್ರೀರೋಗ ತಜ್ಞರಿಗೆ ಇದರಿಂದ ಸಾಕಷ್ಟು ಅನುಕೂಲ ಆಗಿದೆ. ಸೊ ಇದು ಮುಂದೆನೂ ಸಹ ಮುಂದುವರಿಯುತ್ತೆ. ಸೊ ಈ ರೀತಿಯಾದಂಥ ಒಂದು ಕಾನ್ಫರೆನ್ಸ್ಗಳು, ಕಾರ್ಯಾಗಾರಗಳು ಪ್ರತಿಯೊಂದು ಫೀಲ್ಡ್ನಲ್ಲೂ ಇರಬೇಕು. ಆಗಲೇ ಆ ಒಂದು ವಿಜ್ಞಾನ ಅಥವಾ ಸೈನ್ಸು ಡೆವಲಪ್ ಆಗಲಿಕ್ಕೆ ಸಾಧ್ಯ.
ನಾನು ಡಾಕ್ಟರ್ ವಿದ್ಯಾ ಭಟ್, ಡೈರೆಕ್ಟರ್ ರಾಧಾಕೃಷ್ಣ ಮಲ್ಟಿ ಸ್ಪೆಷಾಲಿಟಿ ಹಾಸ್ಪಿಟಲ್ ಆ್ಯಂಡ್ IVF ಸೆಂಟರ್. ನಾನು ಕರ್ನಾಟಕ ಚಾಪ್ಟರ್ IAG ಚೇರ್ಪರ್ಸನ್ನು. ಪ್ರೀವಿಯಸ್ಲಿ ಡಾಕ್ಟರ್ ರಮೇಶ್ ಇದ್ದರು. ನಾನು ಟೇಕ್ ಓವರ್ ಆಗಿ ಈಗ 6 months ಆಗಿದೆ. ರೇಜ್ ಕಾನ್ಫರೆನ್ಸ್ ನಾವು ಕರ್ನಾಟಕ ಚಾಪ್ಟರ್ IAG ಪ್ಲಸ್ IAG ಮೇನ್ ಆಫೀಸ್ ಆಮೇಲೆ ರೇಜ್ ಇದು ಕಂಬೈನ್ ಮಾಡ್ತಾ ಇದ್ದೀವಿ. ಈಗ ಈ ಕಾನ್ಫರೆನ್ಸ್ ತುಂಬ ವರ್ಷದಿಂದ ನಡೀತಾ ಇದೆ. ಈ ಸರಿ ನಾವು ಇದ್ರ ಜೊತೆ ಹೋಸ್ಟ್ ಮಾಡೋಕ್ಕೆ ನಾವು ಮುಂದಾಗಿದ್ದೀವಿ. ಈ ಕಾನ್ಫರೆನ್ಸ್ಗೆ ನಾವು ಆಲ್ ಓವರ್ ಇಂಡಿಯಾ ಒಂದು 30 ರಿನೌಂಡ್ ಸರ್ಜನ್ಸ್ನ ಕರೆದಿದ್ದೀವಿ. ಈಗ ಬೆಳಿಗ್ಗೆ ಒಂದು 8 ಗಂಟೆಯಿಂದ ಶುರುವಾಗಿದೆ, 4 ಕೋಟಿ ನಡೀತಾ ಇದೆ. ರಿನೌಂಡ್ ಸರ್ಜನ್ಸ್ ಎಲ್ಲ ದೇಶದ ವಿಧ ಭಾಗದಿಂದ ಬಂದು ಆಪ್ರೇಟ್ ಮಾಡ್ತಾ ಇದ್ದಾರೆ. 400 to 500 ಡೆಲಿಗೇಟ್ಸ್ ಇದ್ದಾರೆ. ಅವರೆಲ್ಲ ಏನಕ್ಕೆ ಬಂದಿದ್ದಾರೆ ಅಂದರೆ ಇದು ಒಂದು ಹೊಸ ಟೆಕ್ನಿಕ್ ನಾವು ತೋರಿಸ್ತಾ ಇದ್ದೀವಿ, ಸರ್ಜಿಕಲ್ ಟೆಕ್ನಿಕ್ಸು. ಈಗ ಎಷ್ಟೊಂದು ಎಲ್ಲರೂ ಮಾಡ್ತಾ ಇರುತ್ತೆ, ಬಟ್ ಏನೋ ಒಂದು ಹೊಸ್ತು ಬಂದಿರುತ್ತೆ, ಅದನ್ನು ನೋಡಿರಲ್ಲ. ಸೊ ಅದನ್ನು ನೋಡಿ ತಾವು ಕಲಿತು ಹೋಗಿ ತಮ್ಮ ಊರಲ್ಲಿ ನಾವು ಪೇಷಂಟ್ಸ್ಗೆ ನಾವು ಅದನ್ನು ಹೆಲ್ಪ್ ಆಗೋ ಥರ ಉಪಯೋಗಿಸೋಕ್ಕೆ ಇಲ್ಲಿ ಬಂದು ಜನ ಕಲಿತಾ ಇದ್ದಾರೆ. ಸೊ ಇದು ಮಾಡೋದ್ರಿಂದ ನಾವು ತುಂಬ ನಾಲೆಡ್ಜ್ ಸ್ಪ್ರೆಡ್ ಆಗ್ತಾ ಇದೆ, ತುಂಬ ಜನಕ್ಕೆ ಅವೇರ್ನೆಸ್ ಬರ್ತಾ ಇದೆ. ಇದನ್ನು ಕಲ್ತಿರೋ ಗೈನಕಾಲಜಿಸ್ಟು ಆಲ್ ಓವರ್ ಕರ್ನಾಟಕ, ಸೌತ್ ಇಂಡಿಯಾ ಹೋಗಿ ತಮ್ಮ ಪೇಷಂಟ್ಸ್ ಮೇಲೆ ಅವರು ಈ ಮೆಥಡ್ಸ್ನ ಯೂಸ್ ಮಾಡಿದಾಗ ಎಷ್ಟು ಪೇಷಂಟ್ಸ್ಗೆ ಬೆನಿಫಿಟ್ ಆಗುತ್ತೆ. ಸೊ ಈ ಬೆನಿಫಿಟ್ಟಿಂದನೇ ನಮಗೆ ಈ ಸೊಸೈಟಿಗಳು ಇಂಟೆನ್ಷನ್ ಅದೇ, ಪೇಷಂಟ್ಸ್ಗೆ ಬೆನಿಫಿಟ್ ಆಗಬೇಕು, ಅಲ್ಟಿಮೇಟ್ಲಿ ಪೇಷಂಟ್ ಕೇರ್ ಇಂಪ್ರೂವ್ ಆಗಬೇಕು. ನಾವು ಏನೇ ಸರ್ಜರಿ ಮಾಡಿದ್ರು, ಏನೇ ಒಂದು ಇನ್ಸ್ಟ್ರೂಮೆಂಟ್ ಯೂಸ್ ಮಾಡಿದ್ರು ಅದು ಪೇಷಂಟ್ಗೆ ಬೆನಿಫಿಟ್ ಆದರೆ ಮಾತ್ರ ನಾವು ಯೂಸ್ ಮಾಡಬೇಕು. ಜೊತೆಗೆ ಕ್ವಾಲಿಟಿ ಕೇರ್ ಜೊತೆಗೆ ನಾವು ಅಫೋರ್ಡಬಲ್ ಕೇರ್ ಅಂದರೆ ಪೇಷಂಟ್ಸ್ಗೆ ಅದು ಎಫೋರ್ಡ್ ಆಗೋ ರೇಂಜಲ್ಲಿ ಇರಬೇಕು. ಈಗ ತುಂಬ ಎಕ್ಸ್ಪೆನ್ಸಿವ್ ಅಪ್ಪ, ನಮಗೆ ಅದನ್ನು ಎಫೋರ್ಡ್ ಮಾಡೋಕ್ಕೆ ಆಗಲ್ಲ, ನಾವು ಇದನ್ನು ಡೇ ಟು ಡೇ ನಮ್ಮ ಪ್ರಾಕ್ಟೀಸಲ್ಲಿ ಅಳವಡಿಸ್ಕೊಳಕ್ಕಾಗಲ್ಲ ಅಂದರೆ ಅದು ಪ್ರಯೋಜನ ಇಲ್ಲ. ಪ್ರತಿಯೊಬ್ಬರಿಗೂ ಅದು ರೀಚ್ ಆಗಿ, ಅಂದರೆ ರೀಚ್ ದ ಅನ್ರೀಚ್ಡ್ ಅಂತ ಹೇಳ್ತೀವಿ. ಅಂದರೆ ಕರ್ನಾಟಕದ ಮೂಲೆ ಈವನ್ ಹಳ್ಳಿಗಳಲ್ಲೂ ಕೂಡ ಈಗ ಲ್ಯಾಪ್ರೋಸ್ಕೋಪಿ ಬಂದಿದೆ. ಸಣ್ಣ ಊರಲ್ಲಿ Tier 2, Tier 3 ಸಿಟೀಸ್ ಅಂತ ಹೇಳ್ತೀವಿ. ಸೊ ಅಲ್ಲೆಲ್ಲ ಈಗ ಲ್ಯಾಬ್ ಸರ್ಜನ್ಸು ಕೀಹೋಲ್ ಸರ್ಜರೀಸ್ ಮಾಡ್ತಾ ಇದ್ದಾರೆ. ಈ ಥರ ನಾವು ಒಂದು ಕಾನ್ಫರೆನ್ಸ್ ಮಾಡಿದಾಗ ಅವರೆಲ್ಲ ಬಂದು ಹೊಸ ಟೆಕ್ನಿಕ್ ಕಲಿತು ಆ ಪೇಷಂಟ್ಸ್ಗೆ ಅವರು ಅದನ್ನು ಹೆಲ್ಪ್ ಆಗೋ ಥರ ಉಪಯೋಗಿಸ್ತಾರೆ. ಥ್ಯಾಂಕ್ ಯು. ಬೇರೆನೇ
ಆರೋಗ್ಯ ಮಾಹಿತಿಯ ಇಂಥ ಮತ್ತಷ್ಟು ವಿಡಿಯೋಗಳಿಗಾಗಿ ವಿಶ್ವವಾಣಿ ಹೆಲ್ತ್ ಯೂಟ್ಯೂಬ್ ಚಾನೆಲ್ ಸಬ್ಸ್ಕ್ರೈಬ್ ಮಾಡಿ.